Okay, I'm talking about conjunctiva that we're going to talk about right now, so I'll just write that down. Conjunctiva. Conjunctiva has three parts. Obviously, we're going to go rapid. This is going to be a rapid revision lecture, and obviously, we're going to cover conjunctiva in less than 30 minutes. So, first of all, there are three parts of conjunctiva. There's the first, the palpable part, the bulbar, and the fornix. The palpable is the one that is under the eyelid. If let's say this is the eyelid, or you can say certain hair cells, these are the palpable part. This is the fornix part. This is the fornix part, and this is going to be the bulbar part, the palpable, fornix, and the bulbar. Now, this is very important in the sense of which type of conjunctiva are we talking about, which kind of which region that it involves. All of that is important simply because of the fact that we are talking about the different parts of the conjunctiva that can be involved by any particular etiological disorder, etiological agents rather. So this is the fornix, fornical conjunctiva, this is the bulbar conjunctiva, and this is the palpable conjunctiva. Now obviously when I'm looking at the very important aspects of conjunctivitis rather, let me talk about conjunctivitis directly. Conjunctivitis is depending upon a uh, very important hallmark of conjunctivitis rather is that it is an inflammatory disorder. Obviously it's inflammation. Let me just write it, conjunctivitis. So it's inflammation, it's obviously inflammation, it's going to be redness. So now this redness that we're going to look about also, it's going to be chemosis. There's going to be chemosis, there's going to be, let's say, follicles or a papillary reaction, follicular slash papillary reaction. We're going to look on that too. We're going to talk about it too. And obviously there's going to be a very important discharge. There are going to be discharge, obviously mucopurulent or watery. We'll talk about that too. So conjunctivitis is basically a redness, thickness, foreign body sensation, lacrimation, excess lacrimation, and that is something that we have all actually studied and we all have actually experienced also once and ever in our lifetime. So that is exactly what conjunctivitis is. But now let's break each of these words into in great detail. Now inflammation. First, let me tell you about what isn't. So when I'm saying conjunctivitis is inflammation, what could be the causes of inflammation, right? Inflammation. So when I'm talking about inflammation, obviously it could be due to a bacterial cause, it could be due to a viral cause. And why am I right? And I could write in the bacterial itself chlamydial, but I'm going to write chlamydial cause is different. It could be a protozoal cause, who knows? All right, it could be a protozoal cause. So that could be one of them, or it could be an allergic cause. Correct. So inflammation could be one of those. Now after that, obviously the second thing that we need to understand is redness. Why is there going to be redness? All right, so in redness also there are two types of redness. First of all, which is going to help us understand if it's a conjunctivitis, or let's say it is something that is associated with cornea or uvea, something like that. So if this is your eye and this is your eyelid, obviously this is something that's called circumcorneal. This is circumcornea because this is the cornea. So around the cornea is called circumcorneal conjunctivitis. Now let's say if I see a certain amount of redness in the circumcorneal conjunctivitis, what is pointing towards is that there could be keratitis. All right, there could be keratitis, there could be uveitis. All right, or there could be glaucoma. What is keratitis? Keratitis is inflammation of cornea. Uveitis is basically inflammation of the uvea or the uveitis tract of the uvea directly. I'm not going to say uveitis tract. And obviously we have the glaucoma that could also be seen, that could also show certain amount of circumcorneal redness. Obviously in conjunctivitis you have conjunctival redness, that is the periphery is usually involved. Obviously that doesn't have to be confused. Now when I'm talking about redness, certain people also confuse it with subconjunctival hemorrhage. Now subconjunctival hemorrhage is not characteristically a part of conjunctivitis. Subconjunctival hemorrhage, definitely not a characteristic thing about conjunctivitis, but definitely it is also seen. Subconjunctival hemorrhage is seen, and that does not necessarily mean that subconjunctival hemorrhage is going to only occur in the corneal part, in the conjunctival part. It can also occur in the circumcorneal part depending upon which part of the conjunctiva is definitely damaged. So therefore that does not mean that if you see, let's say you see subconjunctival hemorrhage in the circumcorneal part, that means you rule out that it is not conjunctivitis. Obviously that's not what I'm saying, but that's why I had to get that clear. And obviously another very important terminology that we had used, we also used chemosis. Now what is chemosis? All right, what is chemosis? Chemosis is nothing but inflammatory swelling. What do you mean by inflammatory swelling? Obviously as a reaction of inflammation there is going to be swelling of the bulbar conjunctiva. So when there's swelling of the bulbar conjunctiva, you can see that it is chemosis. So I'm just going to write swelling because it's quite self-explanatory. Now I cannot explain what swelling is. We all know about it. Now the third very another important point that I've written is the follicular papillary reaction. We're going to look that follicular and papillary reaction is very important because of the fact that there is certain amount of inflammatory reactions. They're just inflammatory reactions that are seen. There could be follicles, or there could be papillary reaction. Now, what is the etiologenesis of it? What is the cause of it? Obviously, papillars are seen because of increased vessels, but follicles are seen due to increased lymphatics, and because of increased lymphatics. Obviously, now let me go into the details of it. Increased vessels and increased lymphatics. Obviously, the blood supply to the cornea is coming by what? The blood supply of cornea is going to be from the anterior ciliary artery. It's also going to be from the marginal arteries of the conjunctiva. So the anterior ciliary artery is going to give something called as the posterior conjunctival artery, and the marginal artery is also going to give an anterior conjunctival artery. And these two arteries are going to supply a lot of the conjunctiva, the bulba, the palpable part, all of it. And when these basic blood vessels, they show certain amount of hypertrophy, obviously we could say that there's a papillary reaction. Now, what about the follicles, the lymphatics? All right. Now when you're talking about the lymphatics, let me go into another color. Let me go green. When I'm talking about lymphatics, obviously let me denote it in green. So lymphatics. Let's say if this is the eyeball. This is the eyeball. This is the nose. So this is going to be the medial part of the eyeball. This is going to be the lateral part of the eyeball. Now, when I'm talking about the lateral part, let me just make a let me make a division ASAP. So this is going to be the lateral part. This is going to be the medial part. Obviously, from the medial part, the lymphatics are definitely going to go into the submandibular lymph nodes. What are they going to go into? The submandibular lymph nodes. And the lateral part is going to go in the preauricular lymph nodes. So the preauricular lymph nodes and the submandibular lymph nodes are two lymph nodes that are going to be involved. So let me just write it down again. Submandibular lymph nodes. And obviously we're going to have preauricular lymph nodes. So there's just another very important MCQ point that could be asked also is which lymph nodes are involved. Now, after we've spoken about all the hallmarks of conjunctivitis, let me just directly go into one of the very important causes of conjunctivitis, that is bacterial conjunctivitis. Finally, let's go into bacterial conjunctivitis. Now, the bacterial conjunctivitis, what is the pathogenesis of a bacterial conjunctivitis? Let's say a bacterial infection. Obviously, you're first going to have an infection. So, B infection, bacterial infection. Correct. Bacterial infection. Second, what are you going to have next? Obviously, you're going to have as a reaction an inflammatory procedure. We're going to have an inflammatory procedure, right? Not a procedure, but an inflammatory reaction. So we're going to have an inflammatory reaction, which is going to cause what? It's going to cause vascular congestion. Correct. It's going to go vascular congestion and proliferation. So if there's vascular congestion, what did I say right now? I said it just right now that a vascular congestion would definitely mean increased vessel. That would mean a papillary reaction. So what would you see? You'd see papilla. I'm just writing it down. Obviously, I'm just talking about the pathogenesis, but I'm just going to write it down so that we have a clear understanding when you're talking about the signs of bacterial conjunctivitis in particularly. So obviously, we're going to say that there is going to be a papillary reaction. Obviously, the papillary reaction is going to be followed by what? There's going to be a vascular inflammation and response and proliferation. So obviously, if there is inflammation, what next has to occur? There's obviously going to be cellular proliferation. In the conjunctiva, plus obviously your infiltrate. Obviously, and then what is going to happen is that there is obviously going to be certain amount of degeneration of the conjunctival epithelium. And the conjunctiva has a superficial non-keratinized stratified squamous epithelium. So because of all the cellular infiltration, proliferation and damage, there's going to be conjunctival sloughing. There's going to be degeneration and conjunctival sloughing. There's going to be sloughing of the cells, the conjunctival superficial epithelium, and obviously there's going to be conjunctival discharge. So when I told you about that there's going to be discharge, this is how the discharge actually occurs. The discharge is usually pus media. It could be obviously mucopurulent in the case of the bacterial conjunctivitis. So obviously if they ask you what kind of a pus is seen in bacterial conjunctivitis, you have to say obviously it's going to be in bacterial conjunctivitis, because the bacteria is seen. Obviously there's going to be bacteria, there's going to be certain amount of mucus. Why there's going to be mucus? Because of the superficial epithelium being sloughed off, and the superficial epithelium of the conjunctiva also contains a lot of amount of goblet cells. So because these goblet cells are basically being sloughed off, obviously going to have bacteria plus mucus, and bacteria is nothing but pus. Bacteria plus WBCs is pus. So we're going to say it is a mucopurulent discharge. It's going to be a what discharge? It's going to be a mucopurulent discharge. Now let's come to the examples of acute bacterial conjunctivitis. obviously we're going to talk about first is going to be a very important because I told you about the pathogenesis of mucopurulent of bacterial conjunctivitis. What is going to be the hallmarks? Let me talk about the hallmark of all bacterial conjunctivitis, no matter what you're talking about, except chlamydial bacterial conjunctivitis that we are not going to see in this particular bacterial conjunctivitis. Also, hallmark is going to be what? There's going to be papillary reaction, and there's going to be a mucopurulent discharge. All right. So now let's go to acute mucopurulent conjunctivitis. Acute mucopurulent conjunctivitis. Acute mucopurulent conjunctivitis. Acute mucopurulent conjunctivitis. What is the most common cause of it? Most common cause, Staphylococcus aureus. All right. How do you want to treat it? You want to treat it by using topical antibiotics. Is that it? Obviously, no. You could also go quinolones. You could go a lot of stuff. But the reason why it directly went to its treatment is because in acute mucopurulent conjunctivitis, there's something which is important to note. What is important to note is that the symptoms and the signs. The symptoms are going to be that the patient is going to come with discomfort. And see, in most of the cases that you would probably even think of, it's acute mucopurulent conjunctivitis. All right, it is acute mucopurulent conjunctivitis. The patient comes with discomfort. He says he has mild photophobia. He has itching. He has colored halos. All right, colored halos. All right. And the signs is going to be simple. The signs are going to be mucopurulent discharge. Come on, the name says it all. The mucopurulent discharge. And obviously, you're going to have a very important thing that is going to be stickiness of the eyelid. Why is there going to be stickiness of the eyelid? Because of the discharge. Come on, dude. That's so simple. Right? That's so simple. Obviously, what are the other things, the other associations that I can write when I'm talking about this particular disease is that I can say blepharoconjunctivitis. What is blepharoconjunctivitis? Blepharoconjunctivitis is blepharo means lid and conjunctivitis means conjunctiva. So, and itis means inflammation. So, lid conjunctivitis, inflammation. So, there's going to be inflammation of the conjunctiva and the lid in the acute mucopurulent conjunctivitis. Coming to the next is going to be acute purulent or hyperacute. Acute purulent, hyperacute, let me write it, hyperacute. Or we could write also blenorrhea. All right. Blenorrhea. Blenorrhea rhymes to what? It rhymes to gonorrhea. So the cause is going to be what? It's going to be gonorrhea. Oh my goodness. It's so simple. Obviously, it's purulent. I'm not saying mucopurulent. It's a purulent. So what's the discharge going to be? It's going to be only pus. So discharge. That's a very important point. That's why I'm writing it differently. It's only pus. Pus only. No mucus. No mucus. Very important. Obviously, what is going to be the cause, or what is going to be the etiology? Etiology is obviously the end, gonorrhea. But what is going to be the method of infection? Method of infection is going to be obviously a very important oculogenital transmission of gonorrhea. Oculogenital. Now, very important point is that this can be seen in kids. Yes, definitely it can be seen in kids, because Neisseria gonorrhea, if the female mother in particularly if the mother has an gonorrhea infection in her genital tracts, has a vaginal gonorrhea infection, obviously it could lead to oculogenital infection in infants and could lead to infant conjunctivitis. All right, that we'll see later on again. But obviously, this is very important, that oculogenital, let's say probably you have an infection in your genital area, and somehow, because they say that you should always wash your hands after checking your genitals, because of the fact that you could also transfer it directly into your eye. Now, what are going to be the symptoms? The symptoms are going to be what? They're going to be high amount of swelling. Obviously there's going to be intense pain. There's going to be pain. In which case, in most of the cases, it's probably just discomfort. But obviously, that when I'm saying pain, intense pain, I mean that it's going to be gonorrhea. Now, obviously, there's also going to be other signs. There are going to be signs like what? There could be itching. Itching as a symptom. There's going to be intense pain. There's going to be itching. There's going to be redness, whatever. But when I'm going to go to signs, the signs, obviously, there's going to be purulent discharge. Very important. Purulent discharge, not mucopurulent discharge. Obviously, purulent discharge. Also, what's going to be the very important sign. Very important sign is going to be preauricular lymphadenopathy. Preauricular lymphadenopathy. That means from the lateral part it's going again into the preauricular lymph nodes. Again, if you want to check, this is the eyelid. This is the way that lymphatics are going to go drain into the preauricular lymph node. Obviously, the antibiotics are going to be IM ceftriaxone that you're going to give. Obviously, the treatment, obviously, the same as when you give for gonorrhea as ceftriaxone. I hope you know that it is the drug of choice. It's a third generation cephalosporin that you can give. It's obviously an IV cephalosporin or IM cephalosporin. Or if you want to go for something which is only, you want to go for erythromycin, obviously, or erythromycin is a very commonly given erythromycin as the drug. Also, that's something that again which has been dealt with. Now, let's go to the third part. That's the acute membranous conjunctivitis. All right, what do you mean by membranous? Obviously, it membranous. Now let me talk about the membranous. But which bacteria that you think of can lead to membranous disease? Like, let's say it could form a membrane, it could form a pseudomembrane. Obviously, if you thought about it, is Corynebacterium diphtheri. Obviously, Corynebacterium diphtheri, which forms pseudomembranes in the oral cavity, can lead to what? A bullneck formation. Obviously, we could talk about that later. But Corynebacterium diphtheri is very important when you're talking about acute membranous conjunctivitis. Acute membranous conjunctivitis is by Corynebacterium diphtheri. Obviously, what is it? Where do you see it? Where you see it, and very commonly, or let me write about the epidemiology. It's seen in non-immunized. Usually, we give a lot of Corynebacterium diphtheri. Also, children in children. But now, let's say your children have been immunized, but now we are not seeing it in children. We are seeing it in adults. So in adults, what's gonna be the most common cause for your acute membranous conjunctivitis? Obviously, it's gonna be pneumococcus. I hope you know what I mean by pneumococcus, streptococcus pneumonia. That's going to be the most common cause for acute membranous conjunctivitis. Pneumococcus can also cause petechial subconjunctival hemorrhages. What can it cause? It can cause petechia and a subconjunctival hemorrhage. So if you see acute membranous, you could see membrane fused. You could see certain amount of hemorrhage. Definitely, you want to think about acute membranous conjunctivitis. What happens is that there is, let's say, if this is the if there's a conjunctiva, the membrane of the conjunctiva is fused with the so let's say if this is your eye and this is your conjunctiva, certain membranes are formed, and these membranes are often fused. Because they are fused, I'm saying it again, because they are fused, on removal we see bleeding. That about being it. So that is another very important acute conjunctivitis that we have covered. Any other conjunctivitis that you could also think of is obviously, let's talk about acute pseudomembranous conjunctivitis. Now you would be thinking, what is pseudomembranous conjunctivitis? Why is pseudomembranous conjunctivitis also formed? Okay, now this is a very important disorder. Which one was this? This was third. Membranous. All right, let me go for the fourth one. Acute pseudomembranous conjunctivitis. What is acute pseudomembranous conjunctivitis? Pseudomembrane basically means that the membrane is not fused. Membrane not fused. Out here, the membrane was fused, so when it was removed, obviously it bleeds. So it's not bleed. If it's not fused, it's not going to bleed. Is that simple? Yes, it's simple. So what is the cause? What's going to be the cause of this? The cause is going to be simple. It's going to be Streptococcus pyogenes. All right. What about the above one, where you could see a complete membrane, acute membranous conjunctivitis? That is going to be Streptococcus pneumoniae. All right, that's very important to be noted. All right. Now the fifth one. All right, this is very important. This is angular conjunctivitis. Why do I say this is important? Or I could also say as diplobacillary conjunctivitis or angular conjunctivitis. What is the cause? The cause is going to be Moraxella lacunata. What is the complaint? Or what is the presentation? What is the presenting thing? Very important. Very, very important. There's going to be excoriation of the lateral marginal strip. And there's going to be a certain amount of redness of the intermarginal strip. There's going to be excoriation of the lateral canthi. There's going to be a reddening of intermarginal strip. There's going to be blepharitis. There's going to be foamy discharge at the angles. There's going to be hyperemia of the lid margin. Oh my God, do you think I've been saying some crap? No, look at this. Now let me just go directly into it. This is your eye, this is your nose, this is your nose. This is your eye, this is your eyeball, this is your lateral canthi, this is your medial canthi. I'm looking at the lateral canthi now. Let's look at the lateral canthi. What is the lateral canthi? This is the lateral canthi. What are you going to see at the lateral canthi? Obviously, you're going to see excoriations. Excoriation. Excoriations, correct. You're going to see excoriation at the lateral canthus. You're going to see redness at the intermarginal strip. You're going to see redness around here at the intermarginal strip. You're going to see blepharitis. You're going to see inflammation of the lids. You're going to see certain intense inflammation of the lid. All right. What else are you going to see? You're going to see a lot of amount of discharge at the angles. You're going to see discharge at the angles, both angles. Pardon me. And obviously, you're going to have hyperemia of the lid margin. Obviously, at the lid, there's a lid margin, right? Let's say this is your eyelid, this is your lid margin. At the lid margin, you're going to see a certain amount of hyperemia. What is your patient going to complain of? The patient is going to come, the patient is going to say, oh my god, I'm having certain amount of burning sensations, I'm having a lot of discomfort, I'm having a foamy discharge, I'm going to have my lateral angle, or what he would say is that mere aankh ke baaju mein, our lateral angle of the eye shows a lot of redness. And obviously you're going to see hyperemia of the margin of the lid margin. All right, so this is angular conjunctivitis. And how do you want to treat it? You want to treat it by giving tetracycline. You want to give a tetracycline. All right, or you want to give a zinc boric acid eye drop. All right. That being bacterial conjunctivitis, let me just recap with you ASAP about bacterial conjunctivitis. First, let me talk about acute mucopurulent conjunctivitis. Acute mucopurulent conjunctivitis is by Streptococcus aureus. It's bilateral with peak, where it's usually bilateral with peak at the fourth day of involvement. Let me go and we'll talk about them in each proper manner. So this is your acute mucopurulent conjunctivitis. Acute mucopurulent conjunctivitis, very important. It is bilateral. It has a peak at 4 day. What are the symptoms going to be? The symptoms are going to be discomfort, foreign body sensation, mild photophobia, mucopurulent discharge. The mucus causes blurring of vision. Obviously, there's going to be colored halos that the patient is going to complain because of the mucus. The patient is going to complain of colored halos. Obviously, going to have petechial hemorrhages. Not usually. Petechial hemorrhages are only seen in a mucopurulent discharge if, let's say, your streptococcus if a pneumococcus is involved. And usually when I'm talking about acute mucopurulent conjunctivitis, I'm going to talk about the staphylococcus aureus. Obviously other causes could be, see, the thing is, it's not completely overlapped. It could be certain amount of overlaption can be seen. Certain amount of overlap diseases can be seen because of the different etiological causes. Therefore we cannot actually say that staph aureus is the only cause for acute mucopurulent conjunctivitis. Obviously streptococcus pneumoniae could also be another cause for acute mucopurulent conjunctivitis, but definitely I need you to understand that I'm saying if staph aureus is the most common cause, that's when we are considering it as the normal or the the typical thing to study. Now obviously you're going to see a lot of chemosis. You're going to see chemosis. Oh shit, I forgot to mention chemosis. Obviously a very important thing is chemosis. You're going to see a lot of chemosis. Chemosis is you're going to see in most of the cases, and this is something that's not very new. What could be the complications? What could be the associated disorders? As I said, there could be also a lot of amount of blepharoconjunctivitis. Obviously you could also have keratitis. That's very important. If you have keratitis, what does keratitis means? It could mean that there could be certain amount of information that is now being passed on to the conjunctiva, and when the information passes on to the conjunctiva, that is something that is of great concern. All right, so you could have superficial keratitis. You could have marginal corneal ulceration, because keratitis could lead to marginal corneal ulceration. And after that, let's directly jump into the hyperacute or blenorrhea or the acute purulent. Obviously there's going to be pain, photophobia. Symptoms going to be pain, photophobia. You're going to have itching. You're going to have blurring of vision. Again, you could see halos because of purulent discharge. You could see congestion, chemosis, papillary reaction. As I've already told you, papillary reaction and a mucopurulent discharge or a purulent discharge is a characteristic factor of mostly all the bacterial conjunctivitis that we've seen now. And hyperacute, why do I say it's hyperacute? Obviously I need you to tell you about the day. It happens in 12 to 24 hours. All right, let's say you have infected yourself with an gonorrhea, obviously, or an gonococcus. Obviously you're going to have it in 12 to 24 hours. Gonococcus is very dangerous because of the fact, and gonococcus, let me tell you about the complication of the fact, or why do we say that it's so bad or it's so scary. So gonococcus can invade cornea directly. What do I mean by that? So basically, cornea has a lot of layers. It has an epithelial layer, it has a Bowman's layer, it has a stroma, it has a Descemet's membrane, stuff like that, and again the endothelium. So it directly invades the cornea. It does not need a break in the epithelial. It can directly invade the cornea, and when it can lead into the Bowman's membrane. And the Bowman's membrane or the Bowman's layer is a layer which is a pseudo basement membrane. Is a pseudo membrane because it does not stain past positive. But mind you, Bowman's membrane is a membrane that cannot heal. So if there's damage, if there's a lesion, if there is a damage at the level of the Bowman membrane, obviously you could lead to certain amount of blindness, and that cornea could lead to any amount of plaques that could be seen, and that could lead to vision disruption. Correct. So therefore we really need to be worried about it, because it can invade cornea directly, and when it invades cornea, it could lead to corneal ulcers. It could also cause uveitis. Why uveitis? Because if it involves the cornea, if it goes deeper, obviously it can reach the uvea, so it can also lead to uveitis like iridocyclitis. All right. What do you want to do? You want to go for systemic antibodies like what? Ceftriaxone, as I already told you. Chronic bacterial conjunctivitis. Chronic bacterial conjunctivitis is nothing but chronic exposure to Staph aureus or any of these, and what it can cause is trichiasis. What is trichiasis? Trichiasis is basically when the eye, when the let's say if this is let me come here if this is your eyelid and the eyelashes go inside, this is called as trichiasis, and trichiasis is not a good deal. It irritates, it can cause scarring, so it's not a good deal. It's not a good deal at all. So obviously the cause is going to be Staph aureus, and it could also be gram negative bacteria like protease. So which one would that be? This is basically the sixth type of chronic bacterial conjunctivitis that we have talked about. Conjunctivitis, that is chronic bacterial conjunctivitis. Is just a culmination of all of these. It's very simple if you go according to the basic common sense. It is due to chronic exposure to Staph aureus, usually Staph aureus because it's the most common cause. Also a lot of gram negative bacteria like protease, enterobacter, E. coli, Klebsiella. All of these different bacteria can also cause it. Now what's going to happen is trichiasis could occur. That's inversion of the eyelids or eye of the eyelashes, and there could be eye strain. Obviously there could be eye strain, and how do you want to treat it? You want to treat it by zinc drops. What happens is that zinc prevents the proteolytic activity of the bacteria. So the excoriation or the complete disruption of these particular bacteria is prevented when you use a lot of amount, when you give a certain amount of zinc drops. And that being said, I think we've covered most of bacterial conjunctivitis. Blepharitis node is inflammation of the eyelid margin. Intermarginal strip is where the redness is seen. Intermarginal strip is nothing but when I told you what the intermarginal strip is, what I meant is if this is the eyelid, this is basically the intermarginal strip. So intermarginal strip was seen in angular conjunctivitis. Angular conjunctivitis is the very important cause. It's a very niche. It's something that's niche. Moraxilla laconata or Axenfield. It causes excoriation at the lateral condyle. It causes reddening of the intermarginal strip. It causes blepharitis. It causes a lot of disorders. It has a lot of symptoms. It causes burning sensation, discomfort, redness of eye, blah blah blah, blue blue blue, and foamy discharge. Obviously, that's very important. And proteolysis is seen. How do you want to treat it? By tetracycline and zinc eye drops. That being said about it, streptococcus pyogenes causes something called as acute pseudomembrane conjunctivitis, and that is something that should be noted, that it is pseudomembranes; those do not bleed. And acute membranous is when we are talking about a pneumococcus, and pneumococcus can also lead to a very important disorder that is called as subconjunctival hemorrhages, pedicle subconjunctival hemorrhages. Now, when you talk about the another type of conjunctivitis that you want to talk about is viral conjunctivitis. Now, when I talk about a viral conjunctivitis, viral is usually involving the lymph nodes or the lymphatics. Obviously, that's just basic pathology. So lymphatics and lymph nodes are involved. So because of that, obviously there's going to be a follicular reaction. There's going to be a follicular reaction, and because of that follicular reaction, you're going to have folliculitis. And what kind of a discharge is obviously seen? Obviously, it's a viral infection. Obviously, you're going to see a watery discharge. Can you see a pus? Obviously not. Obviously not. Something that I do not even need to explain. So there's going to be a watery discharge with a follicular reaction. That's the hallmark of viral conjunctivitis, and I do not think I need to mention it every time that I talk about it. So let's talk about the different causes of conjunctivitis. When I'm talking about a viral conjunctivitis, first I'm going to talk about adenoviral conjunctivitis. Second is there's going to be a hemorrhagic conjunctivitis. There could be acute hemorrhagic conjunctivitis. All right, and then third is going to be molluscum contagiosum. Very, very important. So these three are the very important causes of viral conjunctivitis. When I'm talking about viral conjunctivitis in particular, I'm not going to be speaking about any other conjunctivitis. Viral conjunctivitis, first of all, let's talk about adenoviral conjunctivitis. What is adenoviral conjunctivitis? Adenoviral conjunctivitis can actually be grouped. It can be grouped into three types. It can be obviously your epidemic keratoconjunctivitis. It could be pharyngoconjunctival fever, and it could be non-specific acute follicular conjunctivitis. Let me talk about each of them, and then we'll go on to acute hemorrhagic conjunctivitis. Then we'll go on to molluscum contagiosum, and then we'll go to acute herpetic conjunctivitis. Acute herpetic conjunctivitis, very important. So, adenoviral conjunctivitis. Adenovirus. What are adenoviruses? Adenoviruses are a group of viruses that have a particular manifestation, and they have three types. They have three types, as I've already said. EKC, that's epidermal keratoconjunctivitis, and that's seen in adenoviruses of 8, 19, and 37. Another very important is non-specific. Non-specific basically means no corneal involvement. So what's it going to have? It's going to have type 1, 11, and 19. Oh my goodness. Type 1 to 11. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. All of them. Alright. And there's going to be pharyngoconjunctival fever. So what's going to happen? Obviously, you're going to have involvement of the pharynx. Then have periodical lymphadenopathy. Alright, I just told you. Periodical lymphadenopathy is also seen in gonorrhea, acute hemorrhage. Alright, acute purulent. Alright, blenorrhea. Alright. So, this is going to be seen 0R347. Alright. Once you've got that, we can directly jump into adenoviral conjunctivitis. Now, adenoviral conjunctivitis, definitely I'm going to first talk about EKC. Epidermokeratoconjunctivitis. Epidermokeratoconjunctivitis. The name itself. Alright. The name itself is self-explanatory. Why? Because kerato means cornea. So you're going to have punctate keratitis. Or if that does not even strike you, obviously you can say that it has keratitis. Conjunctiva means conjunctivitis. Obviously you're going to have chemosis because it's conjunctivitis. Also you're going to have a hyperemia because it's conjunctivitis. Obviously because it's a viral infection, you're going to have viral shedding. Because it's conjunctivitis, you're going to have hyperemia of conjunctival redness. And obviously because it's viral, you're going to have watery discharge. Obviously there's going to be ocular discomfort because of the chemosis of the conjunctivitis. Obviously you can see follicles. And that is why I'm saying this is just common sense. There's going to be follicles. A complication, or let's say it's a severe case. So what you're going to have? What you could have is petechial subconjunctival hemorrhage. Alright. Wow. So basically what I mean is that you could have a petechial subconjunctival hemorrhage out here also. Obviously, you could see petechial subconjunctival hemorrhage also in Streptococcus pneumonia. And very important is that you could also see certain amount of pseudomembranes. Alright. And where do you see pseudomembranes? You see them at lower fornix. That is why I told you in the basics that the structure of the conjunctiva is very important. What is the corneal involvement? Because I said there's going to be punctate keratitis. Which basically means that there's going to be epithelial, or there's going to be superficial punctate keratitis. That's what I told you. But that's not the only thing. Because first, you're going to have diffuse. You're going to have a diffuse non-staining lesion. First, you're going to have an in lesion, or you're going to have keratitis. Then you're going to have a subepithelial infiltrate before you could lead to superficial punctate keratitis. Correct. Also, there's certain amount of preauricular lymphadenopathy also seen. See, the thing about it is that it cannot be asked in detail because of the fact that there's so much overlap between EKC and a pharyngoconjunctival fever. Now let me talk about a pharyngoconjunctival fever. It's also another very important adenoviral conjunctivitis. Pharyngoconjunctival fever. What are you going to have? Pharyngitis. Conjunctivitis. Fever. Come on, you can't expect me to explain fever. Preauricular lymphadenopathy, corneal involvement with punctate keratitis. I'm telling you, this cannot get easier. It's the same thing. EKC, pharyngoconjunctival fever is the same thing. What is differentiating? Just the pseudoas, obviously, and a little bit of pharyngitis involvement. In EKC, there's no pharyngitis involvement. And in EKC also there's a certain amount of hemorrhage, subconjunctival hemorrhage. Also there is pseudomembrane sperm, which is not seen in pharyngoconjunctival fever. Usually. Again, cases can be seen. Now, what is an acute hemorrhagic conjunctivitis? I spoke about it in the first very three important classifications, the main classifications. Acute hemorrhagic conjunctivitis is by two viruses. One is the picorna. And second, that same sucker, the same very sucker, adenovirus. But this time I'll say adenovirus type 1. So picornavirus and adenovirus. Picornavirus is the same sucker. Adenovirus is the same sucker. So incubation period is going to be 1 to 2 days. It's a viral infection. Come on, you do not expect me to do anything else. You do not expect me to say anything else. Why is there going to be redness? I'm saying it's hemorrhagic. Obviously, there's going to be redness. There's going to be bulbar hemorrhage. There's going to be chemosis. Come on, you cannot expect me to again say the same thing. There's going to be folliculitis. There's going to be watery discharge. I think it's very important that we all say it together. Watery discharge. There's going to be lid edema. And obviously, what kind of a lymphadenopathy? Preauricular lymphadenopathy. What a trend it's following. I love it. And the third that we had very importantly spoken about is molluscum contagiosum. So molluscum contagiosum is basically a very important mollusca shaped lesion, which is usually on the skin. It's an umbilicated nodule, which you could probably check in the dermatology video. It's an umbilicated nodule which has a lot of viral particles, and these viral particles, when they somehow reach the eye due to rubbing, etc., what it causes in Manda Nivache, is conjunctivitis. So that's basically molluscum contagiosum. So it's a very important dermatological association. That is why we had to cover it out here. Now, very important other disorder is acute hepatic conjunctivitis. Acute hepatic conjunctivitis obviously seen much more in detail when you're talking about keratitis. Mode of infection is obviously herpetic. Herpes. Come on. Kissing, close contact, depends on which. HSV1, HSV2, you know about it, right? HSV1, HSV2 is more in the younger people of adolescent or sexually active. All right, so typical hepatic conjunctivitis usually unilateral, along with lesions on the face and eyelid. Obviously, you could have a hepatic whitlow. You're not seen, obviously, not a hepatic whitlow. You could have a labial infection on the lips. You could have a labial lesion of the herpes, definitely. So that's when it's typical. So there are typical and atypical forms. Obviously, the typical is when you have another lesions on the face and you could very easily diagnose it. But atypical is when you have no lesion on the face, you have no lesion on the lids, and the condition is actually something like EKC. Similar. That's a similar sign, not an equal to. In both these conditions, obviously, you can also see preauricular lymphadenopathy. I'm tired of saying it because of the fact that the lateral part of the eye is involved and the lymph are going to carry it. Isn't it just simply because of the fact a viral infection is more or less involved with lymphatics? So that's done with viral conjunctivitis. We are done with viral conjunctivitis. And we have chlamydial conjunctivitis left. We also have ophthalma neonatorum left. And we also have vernal conjunctivitis, or basically allergic conjunctivitis left.